The American Cancer Society projects that in 2022, 62,210 Americans will receive a pancreatic cancer diagnosis. In the US, it ranks as the third most frequent cause of cancer-related mortality. The issue with pancreatic cancer is that there are no early warning signs. In the abdomen, the pancreas is concealed by the stomach, small intestine, liver, spleen, gallbladder, and bile ducts, among other organs. As a result, you might not become aware of a malignant tumor until it has become too large if it begins to grow in the pancreas. There are, however, a few undefined but concerning indications. Let's go over them so you can get medical help when you need it. Number 1. Nausea and vomiting. The site of the cancer's development determines the symptoms of pancreatic cancer. A study published in the Journal of Pain and Symptom Management suggests that the stomach may become partially obstructed if cancer spreads and presses against the far end of the stomach. The food finds it difficult to pass through as a result. This may cause queasy feelings and vomiting. After eating, the nausea and vomiting worsen. Number 2. Pain in the stomach and back of the body. One of the most prevalent signs of pancreatic cancer is pain in the upper abdomen and middle or upper back. These are the intermittent symptoms. According to a research that was published in the British Medical Journal, these symptoms typically arise when the pancreatic cancer develops in the tail or body, placing pressure on the spine. Some people report that the discomfort travels from the middle to the rear of their abdomen. Leaning forward can help reduce this pain, but lying down seems to exacerbate it. Number 3. Jaundice. The pancreatic head, which is close to the common bile duct, is where the tumor even forms. Bilirubin accumulates in the body as a result of the bile duct becoming blocked, which prevents bile from entering the intestine. Jaundice is the end outcome of this. Pancreatic cancer-related jaundice is typically painless and manifests as yellowing of the eyes, nails, skin, darker urine, peritis, and greasy pale stool, according to the World Journal of Gastroenterology. Number 4. Weight loss. Unintentional weight loss that is substantial, unexplained, and alarming would be taken seriously and treated right once, since it may be a sign of a serious medical condition. According to a research in the journal The Oncologist, one of the most typical signs of pancreatic cancer is inadvertent weight loss. Number 5. Fatigue. One of the most prevalent signs of many illnesses, including pancreatic cancer, is fatigue or excessive tiredness. A person may be weary or fatigued for a variety of reasons, but if there's no apparent cause for this extreme fatigue, it shouldn't go untreated and should be taken care of right once. An investigation that was written up in the journal Acta Biomedica states that unexplained weariness is frequently a clue that something is amiss in your body. Number 6. Loss of appetite. Appetite loss or impairment is a sign of a number of illnesses and disorders, including pancreatic cancer. The person loses appetite as the pancreatic cancer spreads throughout the body. Digestion issues, including indigestion, nausea, weight loss, decreased appetite, and diarrhea, are brought on by pressure from pancreatic cyst or tumor on the stomach or small intestine. Eventually, this results in weariness, weakness, and considerable weight loss. Number 7. Enlargement or gallbladder and liver. Pancreatic cancer can occasionally spread and obstruct the bile duct. As a result, the gallbladder enlarges and bile accumulates in the pancreas. As to the research article published in the World Journal of Gastroenterology, your physician can detect the gallbladder enlargement during a physical examination by feeling a significant lump beneath the right rib cage. Furthermore, imaging studies are able to identify an enlarged bladder. Liver enlargement is not the only organ where pancreatic cancer can occasionally cause it. Number 8. Gastrointestinal issues. An individual is likely to have gastrointestinal problems when the tumor expands and starts to push on the stomach or other portions of the digestive tract, according to research published in the World Journal of Gastroenterology. Indigestion, constipation, appetite loss, nausea, vomiting, and abdominal edema or bloating are a few of these symptoms. These kinds of symptoms are undoubtedly linked to a wide range of other illnesses and infections. Nonetheless, these are also rather typical signs of pancreatic cancer. Therefore, if you encounter these symptoms, it is preferable to consult a physician. Seek diagnostic testing to identify the underlying problem. Ignoring these signals could exacerbate the problem. Number 9. Diabetes. Medical imaging scanning that has been done for any other purpose, such as diabetes, can be used to diagnose pancreatic cancer in its early stages. The development of pancreatic cancer may be the cause of the abrupt onset of diabetes. Weight gain is typically unrelated to this type of diabetes. According to a research in the World Journal of Gastroenterology, diabetes without clear reason may also be linked to pancreatic cancer. Pancreatic cancer can spread and damage the body's insulin-producing cells. The body sugar level increases as a result. Most of the time, diabetes is not caused by cancer. Nevertheless, the patient needs to be assessed to ensure that pancreatic cancer or any major underlying cause is not the cause of their diabetes. Number 10. Blood clotting. According to research that was published in the Journal of Hepatobiliary Surgery and Nutrition, the first sign that someone has pancreatic cancer is usually a blood clot in a big vein, usually in the leg. Deep vein thrombosis or DVT is the medical term for this illness. DVT is characterized by pain, warmth, and edema in the afflicted area. In more severe situations, the clot fragment may break off and enter the lungs, impairing the patient's ability to breathe. Severe chest pain is also linked to this illness. Pneumonia resulting from thrombi in the lungs is known as pulmonary embolism, or PE. Recall that blood clots are not always indicative of cancer because they can be caused by a variety of different illnesses. Number 11. A rise in body temperature. A study that was published in the Journal of Medicine states that an increase in body temperature is typically observed with the development of cancer cells. There are two possible ways in which pancreatic cancer can cause pancreatic cancer. First, pancreatic tumors usually obstruct the common bile duct, which may lead to an infection. Second, fever and chills are brought on by the body's response to an inflamed pancreas. Number 12. Itchy skin. According to research that was published in the Journal of Clinical Medicine, pruritus, the technical name for itchy skin, is one of the most common symptoms of pancreatic cancer. Itchy skin, like most other signs of this malignancy, is not a guarantee that a person has pancreatic cancer though. Itchy skin is a sign of a number of illnesses and disorders. As was previously said, the majority of pancreatic cancer symptoms are strikingly similar to those of many other illnesses and disorders. This may cause a delay in the pancreatic cancer diagnosis. Nevertheless, many people with pancreatic cancer have a tendency to look back and begin to associate seemingly unrelated symptoms at the time of diagnosis. It's crucial to pay attention to your body signals and see a doctor if you start experiencing any new symptoms. Most of the time, cancer is not the primary cause. However, in order to keep things growing worse, you must confirm the case with a variety of diagnostic procedures. If you liked the video, give it a thumbs up and share it with your friends. Let us know in the comments down below, do you experience some of these symptoms? You might also want to check out the other videos in our YouTube channel. Just click or tap the videos below here. Thank you for watching.